Good afternoon. Happy May 1st. Around the world, there are now 3.27 million cases of COVID-19 and more than 234,000 deaths. And across our country, there are over 53,000 cases and more than 3,200 deaths. PEI still has a total of 27 positive confirmed COVID-19 cases. No new positive cases to report today. As I mentioned yesterday, there were a total of 6 cases for the month of April. Since yesterday, we have 75 new negative tests to report. In terms of more numbers, we have 2,217 people who are in self-isolation and are receiving calls. Included in that number are over 600 essential workers. We have had more than 1,300 people complete that process of self-isolation in Prince Edward Island. And also in follow-up to a question yesterday, we've had 192 complaints into our office, as well as over a dozen from police and Crime Stoppers. We've had a total of 14 charges laid under the Public Health Act and a large number of warnings, 86 warnings issued. 215 residents were attended, and that is follow-up from a question yesterday. So today marks the beginning of phase 1 of our plan to renew PEI together. And I know many people are looking forward to seeing family and friends in person, to go fishing, enjoy some social time on a deck with friends. Someone mentioned to me that they had bought a couple of new outdoor chairs to celebrate and hope to sit on them with friends outside this weekend. And as of today, outdoor gatherings of no more than 5 people will be permitted as long as physical distancing is practiced. And of course, non-contact outdoor recreational activities of no more than 5 people from different households are also permitted. An example we've used before, and I'll use again, is someone who wants to go on a bike ride with 3 or 4 other friends. Also, select outdoor and construction services such as landscaping, pool maintenance, and a number of others are going ahead today too. I've been asked before why PEI has not gone with a bubble model where you would pick one family or household and only have interaction with that one household. And I think it's important to note that we feel that there's more flexibility to interact with people that in order to meet your physical or your social, personal, and mental health needs by having an ability to be more flexible. And you're not forced also to prioritize a certain family member or another household of friends. And those I appreciate would be difficult decisions. And it's important to recognize that all models certainly have benefits, but regardless of the model, we all share the desire to minimize the risk for the population. And what we've said about this virus and our advice, and I know Marion would say the same thing, it's continued to evolve with the science and what we have learned and what we'll continue to learn about this virus. And that advice will change, and it should change as we learn more going forward. We've been asked different times about the use of non-medical masks, and there are other things you can do that are more effective than wearing non-medical masks. And wearing a non-medical mask in the community does not mean you stop other public health measures that will protect you. And a mask does not replace physical distancing. So the emphasis is still on recommendations regarding staying home, if you're self-isolating, physical distancing, and hand hygiene, which we know really work well to protect you from infection. We'll continue to update the language around non-medical masks, because I think that is an area where the science is and the evidence is continuing to evolve. I know there are many specific businesses and organizations that are trying to figure out how they fit in with the phased approach. And certainly later today, if it's not up already, we'll have an operational template on the website that businesses and organizations can use to plan for how their business or organization can adjust to public health guidelines. Businesses and organizations must have an operational plan in place, and I think that I wanted to make that clear. We've had lots of discussion around the plan, but it's important, and they must have an operational plan in place. I'd like to acknowledge, and I am absolutely empathetic and sympathetic with many of the correspondence and emails that I've received about people who are missing their loved ones in long-term care, and how challenging that is for those who are in long-term care themselves, and how much they're missing family, and of course the family who are missing them. And you know, as we roll out phase one, I do want to acknowledge that those concerns and how important they are, and how significant they are. And we are looking forward and trying to consider all these things as we go into the different phases ahead of us. As we head into another weekend, I ask Islanders to follow the public health measures that we have laid out. It's important that we move through this first phase carefully to protect the health and safety of all Islanders that we've done such a good job doing over the last number of weeks. And I know many people are looking forward to spending some time in person with those they have missed and have been connecting with from afar. As I said yesterday, let's try to be patient, let's try to be kind, and together, not only will we get through this, we are getting through this together. Thank you, and I hope everyone has a nice weekend. Et en français, il y a maintenant 3,27 millions de cas autour du monde et plus de 234 000 morts. Et on a dépassé 53 000 cas au Canada et plus de 3 000 morts. Et nos chiffres ici à l'île du Prince-Édouard n'ont pas changé, heureusement. C'est toujours 27 cas positifs. Et on a eu 75 tests négatifs depuis hier. Et aujourd'hui, c'est le jour 1 de notre plan provincial renouvelé, l'île du Prince-Édouard ensemble. Tout le monde a bien hâte de se voir, d'aller faire des choses qu'on aime beaucoup et avec le beau temps comme la pêche, prendre un verre avec nos amis. Ce sont des petites libertés pour tout l'effort qu'on a mis jusqu'à date contre le virus, mais on doit continuer à faire attention, d'y aller doucement. Je le dis souvent, mais c'est vrai, on veut faire ça comme il faut. Les insulaires peuvent commencer dès aujourd'hui de se rassembler en groupe de 5 maximum, et ça doit être dehors seulement. Et n'oubliez pas de pratiquer la distance physique. Les activités de récréation dehors sans contact sont permis aussi, mais seulement en groupe de 5 maximum. Certains projets de construction de travail extérieur pourront commencer, et tout en respectant la distance physique. Et aussi en français, je vais noter, le port d'un masque non médical dans la communauté ne signifie pas que vous pouvez renoncer aux mesures de santé publique qui ont fait leur preuve et qui contribuent efficacement à vous protéger. Aucun masque ne pourra remplacer l'éloignement physique. Et on va discuter de plus en plus les masques non médicaux, et puis on regarde l'évidence qu'on a partout au monde et au Canada. Je comprends qu'il y a de nombreuses questions des entreprises et des organismes communautaires. Nous comptons avoir de l'information aujourd'hui sur le site web pour aider à répondre à ces questions et puis pour qu'ils puissent regarder, qu'ils puissent commencer la planification d'ajuster leur opération par rapport au plan provincial. Je vous demande tout de continuer à faire ce que on vous demande à tous les jours, surtout ce premier week-end. On doit passer à travers cette première phase avec beaucoup d'attention pour continuer à protéger la santé et la sécurité de tous les insulaires. Je sais que tout le monde a bien hâte de voir leurs proches, de passer du temps précieux avec tous ceux et celles qui leur ont manqué tellement ces dernières semaines. N'oublions pas, s'il vous plaît, de bien respecter les consignes quand vous aurez ces visites et bon week-end à vous tous. Merci.
Hi, thank you and good afternoon, everyone. Our joint response team is continuing to work closely to monitor and plan to care for COVID-19 cases. At the same time, there's ongoing work happening to provide more services to patients that have been delayed or canceled during the initial phases of our health system response. We know that this monitoring and preparedness for this pandemic will continue for a significant period of time, and we are balancing maintaining enough capacity within our hospitals and services to be sure we can quickly and effectively respond to any cases whenever they may happen, while offering more services that Islanders need. The reinstatement of services is being completed under the supervision of team leaders and clinicians from across the health system. And there are also surgical plans completed now for both the Queen Elizabeth and Prince County hospitals for those additional surgeries that now can safely be done within the current situation. These plans were approved today and will be enacted next week, and so some people will be contacted. Just a reminder, and it's a reminder for us in the health system, that we need to do this carefully and safely as we continue to monitor and be prepared for any possible admissions to hospital. It's important for Islanders to know that you will be contacted directly by your care provider or health PEI if your procedure or service is rescheduled under these new plans. There's no need to call providers directly, and we will make sure we contact you. If you've had a change to your health, please contact your family physician or nurse practitioner or contact 811 for care. We'll be monitoring the reinstatement and providing you further information on any additional services that will be restarting as we move forward with the Renew PEI plan. And we want to make sure that you also know that as we monitor the situation, some of these new appointments might be canceled or rescheduled if we need to maintain our capacity within our hospitals or care centers. We will continue to offer the cough and fever clinics and drive-through screening clinics both in Charlottetown and Summerside. And yesterday we saw 50 patients in Charlottetown and 19 at our Summerside clinic. Appointments for those clinics are through 911 or through your family physician or nurse practitioner. Islanders can still access the care they need right now. If you have an emergency, call 911 or visit an emergency department. If your concern is less urgent, again, I would encourage you to contact your nurse practitioner or family physician or visit a walk-in clinic. I want to end my comments today just with some recognition and some gratitude for physicians in our system. Today is National Physicians Day, and I think all Islanders have a significant amount of gratitude for Dr. Morrison and her leadership, but also like to recognize a number of physicians, and too many really to name, who've stepped forward in our health system to help us prepare our protocols, develop our surge capacity plans, lead some of our response through a difficult time. So just congratulations to those physicians and to Dr. Morrison, and thank you for what you contribute to our health system and our community. Thank you.
Happy to take questions.
Brian Higgins, CBC. Yeah, good afternoon, Dr. Morrison and Nurse Dowling. This is a question for Dr. Morrison. We know that essential workers and students and residents are allowed to cross the bridge if they're self-isolating after they get across. I'm wondering if any exceptions are being made because you mentioned that the numbers of people self-isolating have gone up by quite a bit, more than 120 in the last 2 days. That seems like a lot. So wondering what's going on there.
So, hi, Brian. As you indicate, it's everyone who's coming across the bridge has to self-isolate, and now there are, for instance, physicians who may be doing a locum would self-isolate except when they're at work. So there would be certain exceptions made where they can work after coming across the bridge, but even when they're not at work, they need to self-isolate. And so, yes, the numbers are continuing to increase a little bit, and not unexpected because of some work that may be more seasonal that needs to happen. It may be related to construction that and some specialists that need to be here on Prince Edward Island. We're trying to get a better sense of exactly who in that self-isolation group what category they fit into, but the majority also are, as we've talked about, some university students who just are getting home, master's students who are finishing up in other places, and they're finally getting home to Prince Edward Island, and so there's a variety of categories, but we'll continue to watch that carefully because we also have it impacts the volume of our calls every day that we're doing, and I think it has made a difference over the last month, and it's an important part of our response going forward.
Thank you.
You're welcome.
Louise Martin, CBC.
Hi, good afternoon, Dr. Morrison. I know you touched on the expanded bubble approach that's happening in Newfoundland and places like New Brunswick. But we were seeing a lot of comments from people asking, how will I be able to go to the hairdresser in phase 2, get a massage in phase 2, but I'm not able to hug any of my grandkids. So how do you explain the process of allowing some touching with strangers, but not with people in your own family outside of your household?
Absolutely. Excellent question. And I think that's part of that language around the physical distancing. And I know that that has been right up from the beginning a challenge of how we go about this. And we know we hug those in our own family and hold them tightly. And I think this will continue to evolve, and we have to make it very clear as we go forward. And I referenced how do we look after our families who we can't see, and how do we deal with that? But we also have to address that very important question. And one of the, well, not just one, but the many really heartbreaking emails and questions that we've had right from the beginning are about how do you, when can I hug my grandchildren, or when can I hug my mother? And I think this is a good reminder that we need to look at that language of how we communicate that. And some of it has to do with risk. Some of it has to do with what kind of non-medical mask, we refer to those, what other options we have to keep people safe before we even use non-medical masks. And we hope there's a lot of things in place to protect those who are the most vulnerable. And I've even been asked to clarify that when I talk about those who are most vulnerable, it is those who are immunocompromised and over 65. So I think it's a really difficult question, Louise. We're trying to keep other people safe. We want to keep our, especially those who are vulnerable, safe, and yet give people some ability to have outside contact as we go through this phase.
Okay, thank you. Just to clarify, though, about the sort of explaining to people how they're able to be in close contact with, really a stranger, but not close contact with someone outside of their household. Do you know what I'm trying to get at? Like, how do you explain that, or how do you sort of reconcile that with people who are confused about why that rule doesn't apply with someone in a hairdressing salon or a massage parlor?
Well, in the hair, well, first of all, we're not in phase 2 yet, or phase 3. We're in phase 1, but when we get to phase 2, and even in phase 1, it is about physical distancing. We do not want you to hug the hairdresser or anyone else. We are trying to make sure that we're working with businesses and organizations to see what they can do to maintain physical distance, but and still operate their business. And so it is now some of the businesses need to be in closer contact. So your physician might need, we talk about areas where you would need to be closer, and which in essential services have already increased that contact. And we've already been dealing with that. And so it is not trying to figure out how you have close contact with anyone in a business or organization. It's actually trying to figure out how they can function and maintain physical distance or do so in a safe way, which is quite different than what you're referring to in terms of close physical contact with others. So it's, but I do appreciate that we need to articulate that more clearly.
Thank you.
Okay.
Charlotte McCauley, Eastern Graphic.
Good afternoon. I'm not sure who can best answer this question, but I think it's a public health issue. So when can Islanders expect the restrictions on medication refills to be lifted? And I guess to put that in a little more context, I'm asking, are we facing a major supply issue? And if not, does it make more sense to lift the restrictions, thereby further reducing a person's need to go out and be in a public place?
Do you want?
Yeah, I can start by just saying that we still have limitations, and I'm sure the community pharmacies are no different than Health PEI in being placed on allocation from the drug companies, and it's really a supply chain issue. So the same parameters would be in place that have been from the beginning of the restrictions, where people are only being given that 30-day supply, but hopefully we can still rely on the delivery methods and other things to limit individuals having to go out and into pharmacies, particularly those patients or individuals in the community that are the most vulnerable if you're immune compromised or senior and that kind of thing. So I think there are still limitations. There definitely are from our point of view, from the drug companies in the supply. So we have to make sure, and that's what the system is intended to do, is make sure that everyone has access to what they need with the limited supply that's coming. So one individual doesn't get 3 months supply and then another individual doesn't have enough for the coming weeks. So that's why it's kind of managed this way at this point in time. I don't know if there's anything else you want to add, Dr. Morrison, but there's definitely still limitations on the drug supply coming through those drug companies.
I'm not sure I have much to add at this point in time, but I think that will be certainly the medications, pharmaceuticals, drug supply will continue to be something that we look at right across the board and across the system in the community and in through Health PEI.
Okay, thank you.
Okay.
Carrie Wynn McLeod, Ocean 100.
Good afternoon. Dr. Morrison, I just wanted to expand a little bit on, what Louise mentioned there about the hairstyling industry. I've literally received dozens and dozens of messages from a number of stylists right across the province, and it seems to be their main concern is that, why are they in phase 2 and not in phase 3? Of course, there are many concerns about their personal protection because of the close proximity that they would have with their clients, along with the fact that most of those stations are all fixed, and there'd only be probably 1.5 feet between any of the clients and the stylist. I've also been told it's literally impossible almost to cut hair with gloves. The masks they are concerned about because of the heat that's always generated in the salon. And it's all done, the work with the hair dryers and that are all done so close to people's faces that could lend, unfortunately, a bad thing in trying to limit the spread of any viruses and that. I guess they're just not sure why they would be in that phase 2, especially as well that, still at that point only 5 people being able to gather, any salon more than two people, they wouldn't be able to work at the same time at all because they would have to stagger all their clients. And in addition, with the limits of the number of people that can be in the salon, I mean, there's also many that have, sometimes, 14, 15, 20 chairs in some of them.
So, hi, Carrie Wynn. I've and thank you. I've also received some concerns from some of the hair salons. And of course, please, it's important to, first of all, note, just because there's a date there, there's no need to open on any particular date. They're permitted to open any time after if they choose. And we said this right when we talked about the plan, that there would be some who would want to be later, and there are also some who want to be earlier. So we're hearing from but this is based on risk, and there's guidance going out. We are general guidance that we're working with today that will be going out to both for the hair salons as well as the barbers, guidance for both, and they're going to be distributed out through those associations, and then it can get to their members, and I think that will be helpful to address some of the things that you brought up as concerns around some guidance and developing a plan to mitigate those risks. And so I think there's work. I know we're looking at those and reviewing those today, and I think those may be helpful to alleviate the concerns, but also for them to start thinking going forward. And if things change and they do not feel comfortable opening, of course, that's always an option. And so because we want to protect the staff and the employees, but also the public. So it's both going forward. And so I think some of that will be easier to address as they get more information.
Sure. Just to clarify, though, each salon would have to have an operational plan in place.
Absolutely, and I think they'll be better able to develop those operational plans based on the guidance that they will get.
Thank you.
Yes, thanks.
Julien Lecacheur, Radio-Canada.
Oui, bonjour, Dr Morrison. Aujourd'hui, en ce 1er mai de la phase 1, les terrains de golf ont ouvert leurs portes à l'île du Prince-Édouard. Une dizaine de terrains de golf étaient ouverts ce matin. Et j'aimerais savoir, Dr Morrison, quelles sont les conditions, les règles que vous avez données à ces terrains de golf, dans le sens, vous pouvez ouvrir, mais vous devez respecter certaines conditions. Et ensuite, comment vous allez contrôler que ces terrains de golf respectent les conditions que vous leur avez imposées?
OK. On a travaillé avec l'association de golf ici à l'île du Prince-Édouard pour donner la direction, mais eux-mêmes, ils ont fait beaucoup de travail pour avoir un plan, pour respecter les règles de distance physique. Et puis, alors, c'était... il y a une variété de règles et puis des choses qu'on a discuté avec l'association de golf. Je ne l'ai pas tout ici, mais ils ont ils veulent pas qu'il y ait beaucoup de personnes qui attendent pour commencer le golf. Alors, les temps qu'ils arrivent, ils ne veulent pas qu'il y ait beaucoup de personnes pour un grand bout de temps sur le driving range. Je sais qu'ils vont le clubhouse avec, ils vont être, ils sont pas ouverts pour avoir une bière après le jeu de golf. Et puis, alors, je pense qu'ils avaient beaucoup de bonnes idées eux-mêmes, et puis on a regardé le plan avec eux. Et puis, si on reçoit un complaint, on va... nos officiaux au bureau vont le suivre, et aussi on va avoir un certain nombre de business qu'on va juste aller regarder pour voir s'ils respectent les mesures de santé publique, et puis s'il y a un plan en place qui suit.
Juste une précision, et que je m'excuse,
Ouais.
mais est-ce que vous allez pouvoir mettre des amendes? Est-ce que vous pourriez fermer des terrains de golf s'ils ne respectent pas vos mesures?
Mais oui, mais on commencerait en premier avec l'éducation, et puis on a les avis en premier, puis les fines, et puis après ça, on peut faire les demandes.
Merci.
OK, merci.
Laurent Rigaud, la voix acadienne.
Bonjour, docteur Morrison. J'avais une question sur les personnes qui sont toujours malades. Il y a 3 personnes qui sont toujours malades, et si je ne me trompe pas, une, c'est depuis le 8 avril que son cas avait été annoncé. Je voulais juste savoir comment elle va et si ces personnes vont être guéries dans les prochains jours.
Ah oui, bonjour, bonne question. On a quelqu'un qui, j'espère encore, dans les 2 jours qui suivent, on peut annoncer guéri, mais il y a un des cas qui a encore des symptômes, un peu de symptômes, alors on veut qu'il reçoit encore des tests pour être certain qu'il est guéri.
Merci.
Okay.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. L'île du Prince-Édouard a choisi le modèle qu'on commence aujourd'hui, c'est-à-dire avec 5 personnes qui peuvent se rassembler en gardant une distance physique. Le Nouveau-Brunswick et Terre-Neuve ont choisi des modèles différents où on a des bulles, des cellules familiales qui peuvent se rassembler. J'aimerais que vous m'expliquiez pourquoi vous avez choisi le modèle qu'on a à l'île du Prince-Édouard. Quels sont les avantages et les inconvénients des 2 modèles dont on parle ici?
Et je sais qu'il y a des bénéfices de n'importe quel modèle, et puis tous les modèles veulent minimiser le risque aux insulaires ici. On a choisi, on a regardé vraiment les contacts qui arrivent. Et maintenant, on a même regardé le pourcentage de contacts qu'on a réduit. À ce moment, on estime de réduire nos contacts à ce moment. Et puis, avec le nombre de 5, au lieu de faire les boules, c'est plus flexible. On peut vraiment voir un peu plus de personnes qui en a besoin de voir pour nos esprits, pour sociaux, les éléments sociaux. Mais en commençant, c'est dehors, en pas grand nombre. Et alors, c'est plus de flexibilité. Et aussi, l'autre avantage est qu'il vous doit pas choisir entre la famille de votre peut-être sœur et votre frère, et puis vous ne devez pas faire un choix comme ça. Et puis, alors, on a les avantages qu'on peut voir, un peu plus de monde, vraiment. Mais ici, je sais que c'est pas parfait, et il y a n'importe quel modèle n'est pas parfait, mais on veut tout essayer de minimiser le risque de COVID-19 à la population.
Merci.
OK, merci.
Maybe The Guardian.
Hi, Dr. Morrison and Ms. Dowling. I guess my question was also about the bubbling or the two-bubble model. I did just catch the French explanation that you gave to François, but I guess what I'm wondering is it possible that this model might be introduced in later phases in Prince Edward Island? And also, was the enforcement piece part of the reason why it wasn't adopted in phase one? As in, were there concerns about enforcing, a only two household bubble model?
Hi, Stu. So, in terms of the monitoring piece, certainly if you have a family of 8 and another family of 8, all of a sudden that's 16 people outside. That's a little, that's not quite the same as watching, looking at 5 groups of 5. So it wasn't, the enforcement wasn't part of the decision, but it certainly is easier for everyone, not from an enforcement point of view, but even for others to watch. And I know many islanders have been watching each other and looking after each other. So that is sort of it's one part of it, but it wasn't what led to that decision. I think, as you may have heard in French, we do think that there is some flexibility in not doing just a bubble model for us, and it's also based on our epidemiology that we think we can actually have a contact with more than just one family and or one household. And it's not done in big groups, but it's, again, starting outside, keeping physical distance, but it does allow you to, for instance, I could go visit my mother on the weekend and have a visit with her outside on the deck, but I might also have a chance to see a friend with their child out for a walk, assuming, of course, that I would actually have time to do those things. But in theory, that it would be something that we could do. So it will allow some of that interaction to happen. Or maybe I go for a run with a friend, again, keeping 6 feet apart. Not all of those things I would be able to do just with one household. And so all of those things could be important for a family.
Okay, and would this be considered for, I guess, a later phase in the Renew plan for PEI?
Well, as we go through the phases, the goal is if we certainly do not see, we've talked about the outbreaks and increase in cases, and we feel comfortable, the goal is actually to not go to a bubble model where you'd see fewer people, that our phases lay out increased contact, in terms of increased numbers, I guess is the right way to put it, in terms of both inside and outside going forward. So I think I would not necessarily see going to a bubble model, which may actually reduce your ability to have contact with others.
Thank you.
You're welcome. Great. Thank you very much. Have a lovely weekend.